Human Metapneumovirus hMPV is a respiratory virus belonging to the Paramyxoviridae family, specifically the Metapneumovirus genus. It was first identified in 2001 and has since been recognized as a significant cause of respiratory infections, particularly in young children, the elderly, and individuals with weakened immune systems. Although it shares some clinical features with other respiratory viruses, such as respiratory syncytial virus, RSV, hMPV remains underdiagnosed and underreported in many regions. This video explores the nature of hMPV, its transmission, symptoms, diagnosis, treatment, and preventive measures. So don't skip the video and watch until the end. Discovery and background. hMPV was first isolated and identified in the Netherlands in 2001 by researchers who discovered it while studying respiratory infections in children. The virus was found to cause symptoms similar to those seen with RSV infections, such as bronchiolitis, pneumonia, and upper respiratory infections. Structure and classification. hMPV is an enveloped, single-stranded RNA virus. It belongs to the Metapneumovirus genus, which also includes avian Metapneumovirus, which infects birds. The virus particles are spherical in shape and contain an RNA genome that codes for various proteins responsible for viral replication and host cell interaction. hMPV is genetically divided into 4 subgroups: A1, A2, B1, and B2. These subgroups exhibit some variations in their surface proteins, which can affect the severity of infections and the effectiveness of immune responses. The ability of the virus to evolve and exhibit genetic diversity contributes to its continued circulation in human populations and complicates vaccine development. Transmission. Human metapneumovirus is primarily spread through respiratory droplets when an infected person coughs or sneezes. Direct contact with contaminated surfaces can also facilitate transmission. The virus can be inhaled when an individual comes into contact with droplets or touches a surface with the virus and then touches their face, particularly the eyes, nose, or mouth. hMPV is highly contagious, and outbreaks commonly occur during the winter and early spring months, resembling the seasonal pattern of influenza and RSV. It tends to circulate in communities, affecting individuals of all ages. But it is particularly problematic for vulnerable populations, including infants, the elderly, and immunocompromised individuals. Clinical manifestations. The symptoms of an hMPV infection can range from mild to severe, depending on the age, immune status, and underlying health conditions of the individual. Common symptoms include fever, cough, runny nose, sore throat, wheezing, shortness of breath, fatigue, loss of appetite. In young children, particularly infants, hMPV can cause more serious conditions, such as bronchiolitis, pneumonia, and respiratory distress. In severe cases, hospitalization may be required. In older adults or individuals with compromised immune systems, hMPV can exacerbate underlying health problems, such as chronic obstructive pulmonary disease, COPD, or asthma. Diagnosis. Diagnosing hMPV can be challenging because its symptoms closely resemble those of other respiratory viruses, such as influenza, RSV, and the common cold. Diagnostic methods for detecting hMPV include polymerase chain reaction, PCR, immunofluorescence assays, serological tests, viral culture. PCR remains the gold standard for diagnosis due to its sensitivity and specificity. Treatment. Currently, there is no specific antiviral treatment approved for hMPV. Management of hMPV infections primarily focuses on supportive care, which includes hydration. Ensuring that patients remain hydrated is essential, especially in infants and the elderly. Oxygen therapy. In severe cases, patients with difficulty breathing may require supplemental oxygen. Bronchodilators. These medications may be used to alleviate wheezing and breathing difficulties in some patients. Antipyretics and analgesics. Drugs like acetaminophen or ibuprofen can help manage fever and discomfort. Because secondary bacterial infections can develop, antibiotics may be prescribed if bacterial pneumonia or ear infections are suspected. Prevention. Preventing hMPV infections can be challenging due to its highly contagious nature and the lack of an effective vaccine. However, several strategies can help reduce the spread of the virus. Hand hygiene. Frequent and thorough hand washing with soap and water, or using hand sanitizer, can help reduce the spread of respiratory pathogens. Respiratory hygiene. Covering the mouth and nose with a tissue or elbow when coughing or sneezing can help prevent the spread of droplets. Isolation. Infected individuals should be kept away from vulnerable populations, such as infants, the elderly, and immunocompromised individuals, to reduce the risk of transmission. Cleaning and disinfecting. Regular cleaning of frequently touched surfaces can help reduce the spread of the virus in community settings. While there is currently no vaccine for hMPV, researchers are actively investigating vaccine candidates. The development of a safe and effective vaccine could offer significant protection against this virus in the future. If you like my video, then give a thumbs up. Thanks for watching my video.